Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Chris Gill and I am 40 years.
Okay, how may I address you?
Please call me Chris.
Okay, Mr. Chris, today we are going to discuss about your health issues. Is that all right?
Yes, doctor. I am eagerly want to discuss this condition.
Okay, and during our discussion, I might take down some notes which will be highly confidential. Is that okay?
Yes, doctor.
Okay, may I know now, Mr. Chris, that what have brought you here today?
Sorry, doctor. Today morning I noticed I was doing some writing at the time. I noticed that I feel some funny sensation on my right hand, some numbness. And after that, few minutes after that, I noticed that I have some weakness on my right hand also, that I cannot write properly. So I thought that it was due to bad positioning of my hand or pressure on my hand. But that symptom didn't go away after half an hour. I massaged my hand. I take some warm clothing so that I could get better. But this didn't go away. And even now weakness persists, though I don't have that funny sensation, but I think that I can feel my right hand somewhat less than normal.
Okay.
So I visited my doctor because uh, it was about a few days ago. My mother had a stroke, bad stroke, that some bleeding in his brain, bleeding in her brain, and she she is bedridden from that, and she also had this type of symptom. She had sudden weakness on his right side of his body, and after we took her to the hospital, they did an imaging of her brain, and that revealed that she has severe hemorrhage on his brain. So I am extremely frightened after seeing my condition.
Yes, I can get it, Mr. Chris. Okay, and we are going to try our level best to find out what's causing you these problems. Well, may I know that is this the first episode that you are feeling this type of weakness and numbness, or did you feel this type of episode before also?
On my right hand, this is the first time, and about a year ago, I had some weakness on my left leg and some funny sense on my left leg, but that persisted only for a few minutes, maybe half an hour. And after that, it went away. So I didn't pay attention to that much.
Okay, let's can you please tell me that at that time was there only numbness or abnormal sensation or also weakness present?
There was also weakness.
Okay, and this time, can you please tell me that did it come along suddenly or did it come along slowly, gradually?
Came suddenly, but it progressed gradually.
Came suddenly. Okay. Well, can you please tell me that which part of the hand was right hand was involved first, whole hand or only part of it?
All over the hand.
Okay, and did it go to anywhere else this time from the right hand?
No.
What about the other hand? It's all right.
Yes.
Okay, and any leg involvement this time?
No.
Okay, and can you please tell me that have you had any headache this time? Any episodes of headache?
No.
Okay, any loss of consciousness?
No.
Any raised temperature?
No.
Okay, do you have any problem in your vision?
No.
Previously, any problem in your vision? Did you have any episode of problem in vision or pain while using your eye?
Yes, doctor. That when about 1 year ago, I think this was with my leg weakness. That at the time I had some problem in my eyes. That some pain on my eyes. That I couldn't
Okay,
see the light properly. I needed to take off days for about 3 days. from work because that time this was somewhat severe. I thought that this was some viral illness. I heard that some viral illness causes some eye pain, but it went away on its own.
Yeah, I get it. I get it. Well, do you have any? Well, at the time, you didn't. Did you consult any doctor?
No, doctor, I took paracetamol, and after that it went
It
away.
was
I
all
was
right.
just taking some rest and taking paracetamol. That
Okay,
gave
that's
me.
all right. That's all right. Do you feel any difficulty in speech?
No,
Previous difficulty?
no,
Any problem in swallowing?
no,
What about your balance? Do you have any problem in your balance? Keeping balance?
no. I haven't noticed anything.
Okay. And do you have any history of weight loss?
No,
Any lumps and bumps anywhere in the body?
no.
Okay. May I know that what about your water work since this episode? Has it been all right?
Yes,
Oh, and your bowel movement?
fine.
Okay. May I know that do you have any chest pain?
No,
Okay. Any weather preferences?
no,
Any racing and pacing of your heart or any shortness of breath?
no,
Any noisy chest?
no.
Well, may I just come back for a bit to your right hand problem? Well, have you noticed that is there anything that's making your problem worse or better?
I haven't noticed anything. It is unaffected
Okay.
by anything.
And do you feel any pain in your right
No,
hand?
no pain.
Okay. Well, just before this pain started this time, do you feel any warning shots like any lightness in your head or any problem in your vision, anything like that? Any nausea, vomiting, anything like that?
No, I was almost completely fine. Just I was doing some writing. I had
Okay. Okay. Well, did you feel that? Okay. Okay. Well, did you have any episodes of chest infection or raised temperature recently?
no.
Okay. And may I know that? Okay. And may I know that? Do you have any other history of illnesses?
I had some asthma when I was a child, and I am out of any asthma problem for about 30 years.
Okay. May I know what medication do you take for your asthma?
At that time, I take two inhalers,
Yes.
somewhat called salbutamol and another I forgot.
Okay. And do you have to take it regularly now?
No, I am not taking those for last 30 years.
Okay. Are you all right now? Do you have any symptoms now? Any
No,
problems?
no,
Okay, that's all. Do you have any other known medical condition?
no.
Okay, and do you any other drug do you take? Any over-the-counter medication?
Sometimes I take paracetamol for occasional headache, nothing else.
Occasional headache. Well, okay, and can you please tell me which part of the which part is this headache involves? Whole head or
All
specific
over,
part?
all over the head.
Okay, okay. And how frequently does it come?
Maybe once or twice a month.
Okay, that's how long does it persist?
A few hours. And after taking paracetamol, it really goes away.
Okay, okay. May I know that are you allergic to any medication?
No,
I'm sorry to ask, but do you take any recreational medication?
sometimes I take some cannabis when I am with my friends. Nothing else.
Okay, by which route?
Smoking, doctor.
Okay, okay, and actually, this type of intake can harm your say health very much. So it would be better if you stop. And if you want, we can help involve the social services. Is that all right?
Okay, doctor.
May I ask you some other personal questions? Do you smoke?
Yes, doctor.
How many sticks for how long?
About 10 to 15 sticks for last 20 years.
Well, actually, it's very harmful for health. If you want, it's good if you stop it. And if you want, we can refer you to the smoking cessation clinic. Is that all right?
Okay, doctor.
And what about your? Do you drink alcohol?
Yes, doctor.
How many beans per day?
About 5 to 6 units a day.
Okay, and that's actually very much high. And do you have any binge drinking?
No.
Okay, and this much high alcohol can harm your health also, and it's better if you stop it. And if needed, we can refer you to social services. All right.
Okay, doctor.
Okay, may I know about your dietary habit? Do you take all type of food like meat, vegetables, all, or are you a vegetarian?
No, I take whatever I get.
Okay, that's all right. And may I know that do you have any history of your family of similar type of illnesses?
My mother had a stroke, and
Yeah,
doctor
you look
said that that is hemorrhage in his brain.
yeah. Apart from your mother, any other history?
No,
Any history of sudden death in your family?
no.
Okay. And okay. And may I know that did you have any recent history of travel to any country?
No,
Okay. May I know that it's again a personal question. May I know that whom do you live with?
I live with my wife, and I have a serious child, male baby.
Okay. I'm very sorry to ask. It's again a very personal question, but may I know that have you had any casual relationships?
That was about 10 years ago, doctor.
Okay. Okay. That's all right. And since then, you haven't been involved. Am I right?
Yes.
Okay. Okay. I'm very sorry to ask. May I ask you again that have you had any history of blood transfusion in
No,
your life?
no.
All right. And may I know what you do for a living?
Yes, doctor. I'm working for a private company. Really,
Okay.
I need to put a lot. That is a stressful job.
Yeah. Yeah. Okay. And did you go to your office today?
2 minutes remaining.
Well, despite these symptoms, did you
No,
do you think okay, okay. And may I know where do you live? Is it a private home or is a flat or your own house?
it is an apartment.
Okay. May I know that is it a very old apartment or a normal one?
A recent one, doctor. We have shifted a few months ago.
Okay. Okay. That's all right. May I know what your concern is, Mr. Chris?
Doctor, is it a stroke like my mother? Because my mother is bedridden and she is suffering a lot. So I'm extremely afraid of it.
Yes, I can understand your fear. Well, actually, at this moment, I have to examine you thoroughly and also assess you by doing some scanning test and some blood tests. Also, after that, I can get you more with a more clearer explanation. But as long as I have taken your history, I think that it's unlikely that you are suffering from a stroke. Okay, rather, I think that it might be caused by a condition named multiple sclerosis. Please don't bother about the term. Actually, uh, it is actually a condition in your nerve system, nerve tissues, when there can be some inflammation, and some nerve tissues can get affected, and this can actually cause these type of symptoms over and over again in different places of your body. Okay, like at times in your leg, at times in your hands, sometimes eyes, sometimes balance. Okay, so we are not totally sure about it. We will have to involve the nerve doctor and a heart doctor and also our consultant to do the test and then rule out a plan for you. However, there are some other risk factors that can also have to be addressed, like your recreational drug abuse, and also consuming alcohol and smoking. These are also very detrimental for your health, and I think you should be involved with the social services so that you can give up these habits. Are you getting me?
Yes, doctor.
Do you have any more concerns?
Is it a curable condition?
Well, I'm sorry to say that actually, if it is what we say, multiple sclerosis, that it might not be a completely treatable condition. But however, there are many medications which actually help to control the symptoms, and there are also we will also try to involve the multidisciplinary team so that they help to control your complications
Time
if
up.
they arise at all. Is it okay, Mr. Chris?
Okay, doctor.
Any more concerns?
You said that it cannot be treated totally. So, will I be a bedridden patient like my mother?
Well, in many patients, these symptoms actually are well controlled by medications. And if they are up to date with a multidisciplinary team, usually in many patients, they are well controlled. But I cannot completely rule out that you might not get bad, worse in the time. You might get. It will be false if I deny it. But if you are under regular observation, if you take your medication regularly, I think that you might lead a happy and healthy life for a long time also. Are you getting me?
Okay, doctor.
Any more questions?
No, doctor. Thank you.
Okay.
So, what is your diagnosis?
Well, regarding the symptoms, I think that my chief diagnosis would be multiple sclerosis in this patient.
Do you have any differential?
Uh, I think this can be, I think this can be a condition of neuromyelitis optica as well. And I think I just cannot remember of anything else now. But at times, I think that uh, peripheral neuropathy can also be a cause. However, it's quite unlikely. But peripheral neuropathy regarding his alcohol intake, that might also be a cause.
Cannot stroke be a cause?
Yes, sorry, stroke can also be a cause. But however, I think it's a bit unlikely given his symptoms, but it can be a cause. And specifically, since he has some cannabis intake and some alcohol intake, his stroke can also be a cause. And we also have
Intracranial
to
space
rule out whether.
occupation cannot be a cause.
Sorry.
Intracranial space occupying lesion.
Yes. Intracranial space occupation, it can also be a cause.
An infection like encephalitis.
Yes. I actually ruled out that, but that can be a cause.
In venous thromboembolism or venous sinus thrombosis.
Yes.
Okay, so how will you investigate him?
Well, actually, I think we have to investigate him by forming a multidisciplinary unit. At first, we will have to do some routine blood tests like CBC, ESR, CRP. Then we will also have to do his serum urea, creatinine, electrolytes, blood glucose, thyroid profiling, renal function, liver function, uh, and all. Then we will have to do some scanning tests involving his heart, like ECG, 24-hour heart rate monitoring, echo, and also some scanning test of his head, like CT scan of head. And we might also have to perform. We may need to perform uh, CSF fluid study, okay, where we might expect to find oligoclonal bands, and we might also have to do nerve conduction study and electromyography, allography, to, and also we might also have to do some urine test to find out his recreational drug level at his urine.
Okay. You said multiple sclerosis. What type of multiple sclerosis do you think is causing this problem?
I think this patient is suffering from relapsing and remitting type of multiple sclerosis. I think.
What are the other types?
There can be primary progressive, then secondary progressive multiple sclerosis. Uh, I think another one I just can't remember now. I think 4 types: relapsing remitting, primarily progressive, relapsing remitting, and then secondary progressive, and another I just can't remember. Continuous, I think. Sorry, I can't remember another one.
Okay, it's not a problem. So how will you manage him?
Well, this is a difficult patient to manage. Actually, we have to form a multidisciplinary unit involving the joint doctor, the neurologist,
What do you mean by
and the cardiologist. Sorry, the rheumatologist, the neurologist, the cardiologist, and also medicine consultant. We might have to go for
what is
some
the role of
immunomodulation.
rheumatologist?
Mm, I think he might have some muscle aches also at times. So physiotherapist and rheumatologist can also be involved, I think.
Physiotherapist or
Although
rheumatologist? Who is on you will
I think physiotherapist will be more appropriate. Physiotherapist, occupational therapist.
okay.
So I will. We have to form a team comprising neurologist, physiotherapist, occupational therapist for the specific treatment. Actually, for an acute attack, we might go for IV
What is
methylprednisolone.
the role of a
For
occupational therapist?
occupational therapist, if the patient condition deteriorates, then occupational therapist may help to find out a more suitable work or make some adjustment in his own work so that he can work more precisely.
Is it occupational therapist or any other department?
uh, I just can't specify. I'm sorry.
Okay, no problem.
Okay.
Thank you.
And hello.
Yes, thank you.
Okay, okay. Mhm. Well, would I like to finish the management here for acute attack? I think, would I finish it?
Okay, carry on.
Okay, I think for acute attack, we have to give him IV methylprednisolone for 3 to 5 days, and then move on to oral steroids. And for long term, I think different immunomodulatory drugs are available. We might think of giving them, and then other managements are largely symptomatic. Like for spasticity, we can give baclofen, or for urinary retention, intermittent self catheterization, or some medication. And for mood also, we can give some medication, and also we can involve the multidisciplinary team for other complications as well. I think that's all.
Okay, that is fine. So,
Okay.
your history taking was fine. Just was somewhat haphazard. That is, you
Yeah, yeah, yeah,
forgot to ask
yeah, yeah,
family history, and after that, at last you asked about family history.
yeah, yeah, yeah,
And
yeah,
also in the history taking, this was some haphazard, but you covered everything well. That is
yeah, yeah, yeah.
fine. And also occupational health therapist and occupational health department, they are both different.
Well, can you please specify me? That would be helpful for me.
Okay, as far as I remember, occupational health therapist, they are just therapist. They are some advice on
Okay.
any injury that have happened. They treat, or they make. They are involved in the treatment of that, like any injury, burn injury, or anything like that.
Okay. Okay. Okay.
And occupational
Mhm.
health department, they usually assess and make any suitable job relocation. They are involved with that. But,
Okay. Okay. So here, occupational health department, I think, would be needed.
yes.
Okay. Okay. That's. I didn't know that. This has been very helpful.
Again,
Thank you.
read because I read it long ago, so I totally forgot. But read it before saying these words.
Yeah. Okay. That's all right. But still, it's very helpful. Thank you. So I
Thank
think that's all for this.